I'm so delighted to be here with a great group of my partners who have been working on evidence building in King County. And on behalf of King County Metro and the Lab for Economic Opportunities at Notre Dame, I want to give you all a huge welcome. This is the second in our Evidence Matters series of virtual events. And it's so great to see so many friends and colleagues here. So thanks for joining us. I'm Carrie Chihawk. I lead learning and impact strategies and partnerships at King County Metro. And I'm really passionate about advancing racial equity through bringing together our community partners, our research partners, and our staff together. Little heart for you all. To work on being driven by our values and data and evidence informed. And that's why I'm so excited about the topic of this conversation today on building great researcher practitioner partnerships. King County Metro and LEO, that's how we refer to the Lab for Economic Opportunities. We have a really deep partnership, and you're going to hear more about that today, of course. And we've been working together on this series of events, which I'm excited about. And I want to give a shout out to Jenny Garris, who's my planning partner for this at LEO. She's LEO's dissemination associate. And though Jenny's kind of behind the scenes today, she's very much been in, front and center in planning this event with me and getting it off the ground. So our intent with this Evidence Matters series is really threefold. We're looking to build skills and knowledge for our staff at King County, but for others in this field to focus on equitable impact and community outcomes. We want to celebrate some of the successes that we've had in building our evidence-based practice, and we want to share challenges too. And we really want to learn from you and build kind of a community of practice here. So we'll continue to have some of these events about every couple of months, and really look forward to being in dialogue with many of you around that. You'll see that a lot of our content is around transit interventions, because we've been really focusing on that in King County. But I think a lot of what the content, and for this event particularly today, it really should be of interest to many different social sector organizations. So glad to have all of you here and seeing like a range of people from transit, from our transit agency, other transit agencies, and other folks here. We're really fortunate at King County to be working with LEO across a big range of evaluation projects, and our relationship really dates back to 2017. And because of that, we've got projects that are at all stages of the evaluation cycle. Some of our projects are really in the conceptual design phase, while we've got other projects where we have results and we're working together on putting those in use in our decision making. So on our agenda today, we're going to start with a moderated panel conversation, and we're going to highlight 3 projects at King County where we're in the early stages of evaluation. And we want to use those projects, not to talk about the projects in particular, but to really use those projects to talk about researcher practitioner partnerships, draw out some lessons about what makes great partnerships, and bust some myths about that too. And you'll see on our agenda, and as we go through the discussion, that we're focusing on these early stage projects. So our first project, Transportation Navigators, is still in kind of conceptual design phase. Our second project on the subsidized annual transit pass has a very well developed evaluation plan. And in our third project, we really jumped in, quickly built a project, and we're already in data analysis. So I want to point out that, partnerships, great researcher practitioner partnerships, have to extend beyond, kind of the evaluation itself into really understanding the results, disseminating the results. And so stay tuned. We are going to have a part 2 where we look at some of our projects that are in later stages and talk about great great researcher practitioner partnerships with those projects too. Your participation is a lot of what motivates me in having this event, and it's really important to us. So we're going to plan to reserve plenty of time at the end to have conversation, hear your questions, and have discussion. So as you listen to the moderated panel, go ahead and pop your questions into the chat or write them down for yourself. And then when we get to the question and answer period, we'll ask those questions. Or if your question seems like something quick to answer and really relevant to the discussion at hand, we'll just pick that up and answer it within the panel itself. So I want to move to introducing a couple of people. So first, David Phillips from the Lab for Economic Opportunities at Notre Dame. David and I have been working on several research projects together for about 4 years now. And David's really involved in all 3 of the projects that are going to be under discussion today. So I wanted to just call him out at the outset and give him a chance to just say a couple of words.
Sure, thanks, Terry. And yeah, thanks so much for the chance to join in this conversation too. Like Carrie said, I'm a professor here at Leo. I've been involved in this partnership for, it seems, so I guess it's almost 5 years now that we've been working together. And it's King County has been a wonderful partner to work with us at Leo for many reasons. Obviously, we have a shared commitment to building evidence and doing so in a way that is helping both people who are doing active service and creating these programs, but then particularly for the folks who are involved in those programs that would inform these programs to make them better and lead to better outcomes in people's lives. But I think even more than that, I think a lot of what makes this partnership great has been the shared commitment to how we go about doing these partnerships and how we go about creating these evaluations to have that process also be a good thing for the people involved in it. And so really excited today to share about more of the nuts and bolts of how have we gone about building these partnerships? What has worked? What have we learned? What could we do better? And so thanks so much for the chance to participate.
Great to have you here, David. And then I also am so delighted to introduce to you all Bettina Jean-Louis. When I was planning this event, I knew right away I wanted to somehow have Bettina involved. She has really extensive experience leading partnerships with researchers and the community through her role as the research director at the Harlem Children's Zone. But I've gotten to know Bettina through work that we've done together over this last year, where she's been a senior advisor with Project Evident. And we've been working with Project Evident to explore some strategic evidence planning. And Bettina's just been such a wonderful partner in that and really, provided a lot of wisdom and guidance to us. So I've just really appreciated getting to know her. I also want to let you know that a lot of my thinking about what makes for great researcher practitioner partnerships is going to be published in a book that Project Evidence has been working on with the Brookings Institution. It's coming out early next year, so it'll be good timing with the next part 2 of this conversation we're having. And it's part of Project Evidence next generation of evidence campaign, which is really trying to center the practitioner in the lead of evidence building. So excited to have that relationship with Project Evidence, excited that Bettina is here to moderate and lead our panel discussion. And with that, I'm going to turn it over to her.
Thank you. Hello, everybody. I'm really excited to be here. We have a really full and engaging and interesting set of speakers who are going to talk about some great projects that are really going to show what can be done when trustful relationships have been established between organizations that are providing services and organizations that are helping to do research and evaluation that really helps to understand what the implementation and outcomes of those services are. So having been inside an organization, an internal evaluator who was the bridge between external evaluators and the practitioners, I really have seen firsthand how you do have those relationships when you have researchers who understand the values of the organization, and when people work together to tease apart what's important, how it can really have amazing dividends for organizations and for community members. It's not about organizations, it's ultimately about the people that we all serve and want to make their lives better. So having said that, I am going to jump into the conversation because there is a lot to talk about. And the first project is going to be about transportation navigators, as you have heard. And I'm just going to start by asking Jacqueline to introduce herself and to tell us a little bit about the project.
Hi, Bettina. I'm happy to be here today. My name is Jacqueline. I'm a research associate at Leo here at Notre Dame. So Transportation Navigators is a partnership between HopeLink and King County Metro. And the idea for the program basically stemmed from this idea that there are non-cost barriers to public transportation. So these kind of barriers could be like, you need to know how to plan for a trip. You need to know the timing of buses and trains. You have to have knowledge of where the routes go. You have to feel safe, barriers like this. And we can imagine that these barriers could be exacerbated for people who are from another country, who maybe don't speak English, who have a disability, who maybe have kids. So the program pairs clients with a community transportation navigator, somebody who is their mentor, to help them overcome these barriers, to help them plan around these barriers. And this navigator is somebody who's from their own community. So if I'm a Somali immigrant, I would get paired with somebody who's also a Somali immigrant, who would know the cultural context I come from, who would better understand these barriers because they have lived through them themselves. So from a research perspective, our question is really, does this mentoring service improve not only short-term outcomes such as transit use and mobility, but also longer-term outcomes such as employment, health, mental and physical, and other well-being outcomes. Right now, the project is in the planning stages, as Carrie mentioned earlier. So HopeLink and King County Metro are kind of working through what exactly this program is going to look like. It's not set in stone yet, and the goal is to launch the program next year in February. So that's kind of a summary of where Transportation Navigators is at right now.
Okay, thank you so much, Jacqueline. So we're going to turn to David now and ask him to introduce himself and to tell us about how King County got involved with Leo in this project. So what interested you about this particular study?
Hi, Bettina. Yes, so this particular project, I think, grew out of an existing partnership that we had among Leo and King County Metro Transit and some other organizations. I think as an academic, I come to this and sort of, right, there are bigger questions about our society that are important, right? So our cities tend to have lines drawn on the map where people are sorted out by race and ethnicity and socioeconomic status in other ways, right? And so the idea of that those issues are closely tied to how people get around, right, is sort of fundamental to understanding the United States and racial equity and poverty in the United States. This particular, our collaboration with King County Metro initially focused in early years specifically on fare barriers. And we have some earlier work that we'll probably talk about at the second one of these, looking at what happens when people have access to free public transit. And one of the interesting things we found there was that while that encourages transit use quite a bit and might have other outcomes on people's lives, those effects are perhaps a bit more muted for folks who have less access to transit. And so this idea of like, okay, let's think about non-fare barriers and these other barriers that might be going on, like the ones that Jacqueline mentioned, we should learn a little bit more about how important those could be and what sort of programs could help people surmount these additional barriers other than the price tag of getting on the bus.
Thank you. So we're going to turn to Sarah now. This particular soup has a lot of cooks, and just wanted to hear a little bit about HopeLink and the contribution and engagement with the project.
Thanks, Bettina. Hi, everybody. Good afternoon. My name is Sarah Sisko. I'm the program manager for education and outreach on the HopeLink mobility management team. For those of you that don't know HopeLink, we're a community action agency in King County. We focus on getting folks stable and the ability to exit poverty. Our mission is a community free, a community free of poverty. And we really see transportation as a huge part of that. And the goal of my team is to really illustrate to the community that transportation is a resource to accessing services and not a barrier to getting around their community. So we're super excited to be involved in this project because this is kind of a big piece of our core values as a mobility management program, really ensuring that folks have access to the services they need. And that doesn't just mean transportation, that means transportation to these services, that they can reduce costs, that they have support in their native language, and that they have folks that they can work with that really understand where they're coming from. So we were super excited. We've run some smaller pilots of similar type programs. We run similar type programs and have done a lot of learning over the last couple of years, and have been excited to partner. It's going on almost 2 years with Leo and King County Metro for this program.
Okay, so thanks for telling us about transportation navigators. It's an exemplar of fairly more rare than should be the case of a project where the evaluation was introduced in the beginning. And I would like to hear from your perspective, how do you think that was advantageous? So what did it bring that the research component was part of the process from so early on?
Yeah, it's really made it very interesting to think about it from that perspective of what comes first. And I know, David, I think you're going to jump in here as well. And I think for us, it's allowed us to think about what outcomes are we trying to achieve and how can we shape the program so that we understand what outcomes. Are we looking for health outcomes? Are we looking for financial outcomes? One thing we're always looking for is independence and confidence, social interaction, and what the health benefits are of those types of things. And it also allows us to take a critical eye of how we're setting up these programs so that we can really understand what we're trying to get at. And if the way we can propose it and the way that we think about these programs also allows us to engage in a different set of buy-in from our partners and end users. If they can see that we're attempting to create systemic change, or that they're going to have more access to help us create change, we can also build that buy-in. So David, I think you probably have something to add to that as well.
Sure. Yeah, and I think from a researcher's point of view, the benefits of getting involved early are similar, right? So that, as Sarah alluded to, right, one thing that getting involved early does is it brings to the forefront what is the point of this program and what is it trying to do. I think that the temptation as a researcher, right, can be to focus on what is feasible and to start with that, and then go from there, right? Of what is it that is possible? What is it that's easy for us to measure? And I think one thing that getting involved early on does is it nudges the researcher like me to think about, okay, what is the point of this program? What is it designed to do? And then eventually at some point you have to think about feasibility and what we can actually do practically in terms of evaluation. But let's start from the point of view of what the goal of this thing is. I think that's one thing that really comes in from showing up early on. The other one that comes to my mind is that it also allows us to think about how to make sure that evaluation and program design work together rather than working against each other. If an evaluation is going to involve some activities around data collection or what have you, by making sure that those can be built into the program in the most seamless way. If you have some more time, that can allow that to work together as opposed to being sort of more in conflict.
Jacqueline, I thought you wanted to say something.
Yeah, I was just going to say, from a Leo perspective, we work with a lot of different organizations, and so we have a lot of projects that are were brought in at a later stage. And so I think bringing in the research early helps a lot with buy-in in terms of like from the full organization standpoint, because it means that something doesn't have to change in terms of the way that you're providing service. It's already built in from the very beginning. And I think that buy-in is like a big part of research success. And so building it in early means nothing has to really change. And that is always easier for us as humans.
Excellent, thank you. Interesting that you're talking about buy-in, because I would like to ask Sarah about how you've been engaging the community and how you think that has had an impact on design of the program and on the evaluation.
Yeah, I think that's a big piece of what we bring to this program is our desire to put the needs of our communities first. Like I said, we're a nonprofit, so our mission is to engage with the community. And in this process, what we've done is really talk to the community about what they want to see out of a program like this. This past spring, we conducted focus groups with two nonprofits, or two local community-based organizations, the Filipino Community Center, as well as the Somali Family Safety Task Force, and talked to a variety of groups, folks from those different groups. We focused on youth, we focused on seniors, and we also focused on, in particular, women with children trying to access transit, and trying to understand what a program like this would do, community transportation navigators would do for their confidence, do for their ability to ride transit, to get around safely. And it goes back to what I said earlier on those outcomes, whether it's financial outcome, health outcome, or just in general, social interaction and reducing social isolation. We know we've all been through a rough year with social isolation and being away. It's even more evident for our seniors who don't speak English. And so what we've really tried to do is bring our knowledge of working with the community into this program so that we're engaging them at every step of the way. So we did those focus groups and surveys this past spring. We're in, as Jacqueline said in the beginning, we're still in the design phase. And now we'll be going back to the community and testing our assumptions on what we think this program will mean and what the research is going to show us. And we'll be testing that with the community so that they can also help us shape and co-create this program. I can have a lot of opinions on how this program should run from my experience of doing community engagement. We can think about it from a transit perspective, but what we really need to know is how do we shape this program so it's the most effective for the community to use. So that's really the avenue that we bring in is connection to the community and engagement with the community. And we'll be engaging them every step of the way, pre-launch, through evaluation, so that we can understand, are we doing this right? Do we need to take a step back? And having folks like David and Jacqueline as a part of this program allows us to shape those evaluation questions so that we can both get feedback from the community to shape the program, but also see what those outcomes are.
Excellent to hear about the authentic engagement that you all are involved with, where you're not just, making a nod to hearing from the community, but really engaging with them. So we're going to switch our focus now to talk about the next project. Thank you all. I guess previously we talked about an idealized version of the work where everything starts together. Now we're going to talk about another project, and I'm going to ask Maria to introduce herself and to tell us about King County Metro's subsidized annual transit pass.
Hi, everyone. I'm Maria Jimenez-Zepeda. My pronouns are she, her, and I'm a project manager at King County Metro with the Orca Reduced Fares team. So I do some data analysis and project management for a lot of the projects involving our reduced fare programs here at Metro. And so a little bit more about the subsidized annual pass. Metro launched the subsidized annual pass in October of 2020 in partnership with Sound Transit, Public Health, DSHS, Catholic Community Services, with the intention to improve transportation mobility. So the subsidized annual pass eliminates the cost of transit as a barrier by covering the full cost of transit on Metro and Sound Transit services for up to 12 months. And so with the subsidized annual pass, we're really using this as an opportunity to learn how providing access to fully subsidized transit for those with the lowest incomes impacts their transit use, mobility, employment, as well as the health and well-being of them. And so right now we've actually had over 6,000 people enroll in the subsidized annual pass. We've completed the evaluation design, and I'm really excited that we are just about to launch our baseline surveys.
That sounds great. I know you can't wait to jump into those data. So, Krista, we're going to switch over to you. You're probably the most unusual member of our panel today. You're a medical doctor, you're a health researcher. And so could you introduce yourself and tell us why it is that you were interested in working with the Transportation Authority? Tell us about the project.
Yeah, so I'm clinically trained as a primary care doc, and that's probably where the narrative starts. My patients are on the receiving end of transportation services, and so there's lots of stories I could happily share about how our patients have always commented on how they struggle to get to their doctor's offices or be able to reach those facilities. And so I've always been extremely interested in thinking about the connection between how people travel and are transported, really between home or the community to medical care, whether that's my office or any other medical service. And so I got lucky because the Robert Wood Johnson Foundation had reached out to me to say, gosh, there's this really great group of folks up in the Pacific Northwest who are really interested in asking this question. Would you mind connecting with them? And so over the last, I believe it's almost 2 years now, we've been in connection to really kind of develop these thought processes and work in this arena. I'll also say I think it's an incredible opportunity as somebody who does academic research also to think about a really impactful evaluation. You can't really beat being able to study something in the quote unquote the real world as it's being implemented, and really to see hard outcomes here about what impact transportation services or free transportation services here might have on people's health, well-being, and gosh, so many other outcomes that are intimately interact with people's health and well-beings too.
Thank you, Krista. We're going to turn back to David, who's my touchstone now, somehow involved with all of the projects. And I just want to hear from your perspective why it was helpful to work with a health sciences researcher, what it was that brought to the project.
Yeah, so I love these interdisciplinary collaborations where people are bringing their biggest strengths to the team. I think this is a really good example of it, right? So I think with some of that is just about sort of expertise in different spheres. So on this particular project, right, we're really interested, as was mentioned before, in how access to transit and greater mobility affects people's health. I, as an economist, was interested in transportation and racial equity and many other things, but don't have a lot of background in health. I don't know what we should measure, right? Like, what are the, it was like, okay, to go from hearing from people who are running the program to here's what the questions we should ask in the survey. Somebody who has greater expertise in that area, who knows more about health, so there's very practical things like that are helpful. But I think at a deeper level, and where Krista started, I think there's also a lens that health research in particular probably does better than a lot of other disciplines, and that having this, having folks who have specific training both in academic social science research and in being clinicians side by side is something that's quite common in medicine. That's very uncommon in other disciplines. And so you have, maybe oddballs like me or some of the folks associated with Leo who have moved into this space of trying to be at that intersection of academic research and practitioners. But in a lot of ways, I think that one of the things that the health profession and health science research has done really well is integrating those more fully in how people are trained. And so just the lens that Krista brings to our team of thinking about things through the eyes of its patients and showing up to our joint calls and scrubs in between clinic sessions and things like that is a really beneficial thing to our team. That adds a lot.
Thank you. Maria, can you tell us from the perspective of somebody who is implementing an initiative, because it's all about bringing what has been learned from the research and the evaluation back to the work, how it's been helpful to have team members, researchers from different backgrounds with different experiences involved in the work?
Yeah, and first, I actually just want to build off of a point that David mentioned. He mentioned how interdisciplinary this subsidized annual pass evaluation is, but I don't know if folks really understand quite the extent is. So first we have Metro, and so we're kind of experts in our internal data and systems and transit. But then we also have the Leo folks who are experts on kind of this research and how to think of those technological or like other logistics to make sure that we're actually be able to capture that the effects that we're seeing are caused by this intervention of the subsidized annual pass and not due to a lot of other reasons. And then we have Krista, who, like David mentioned, is bringing all of his expertise of both being a practitioner and a medical researcher. That's really helping us bring in what is pretty, I think, new for transit, is being able to make that leap between, is transit impacting not just mobility and economics, but like their health and well-being. That is pretty leading edge research that hasn't been done a lot before. But then we also have PRR, who's like a marketing consulting firm, who's bringing in their expertise on how to reach out to customers, in doing this evaluation work. What are some ways to make sure that we're reaching people in a way that they will be responsive to, that is attentive to their needs and different considerations. And then we also have folks such as, public health and the SHS that can speak to more of that customer experience of like, what does it look like when someone is enrolling in this pass or interacting with these systems? What does it look like for them to be asked some of these questions? And so what's been really striking to me for this program in that kind of super collaborative approach is how much each of us being able to bring in our own knowledge and our own kind of lens of seeing the world makes this evaluation work be more holistic. Instead of looking at strictly from like, here's this transit lens or here's this economic lens, we're able to make sure that the evaluation is capturing more of the impacts of like, how does this impact someone as a whole? What are we learning? And then also, we'll also, I'm sure, learn what are we missing, and that can also spur other evaluation work. And another thing I want to add is that I think when we first started trying to prepare for the evaluation, we're doing it as we were trying to launch the program. And so there was some elements of, oh, these are things that we should incorporate that will be helpful later down the road for evaluation. But we also then learned that we didn't need to try to rush it. And so we actually started, like I mentioned, we started the subsidized annual pass over a year ago, and only now are we starting some of that evaluation component. And looking back at it now, I'm really glad that we did wait and take this time, because I think it helped us to really learn more about the different frames and perspectives that everyone's bringing, and to be able to make it a fuller and richer program that we'll learn a lot more from.
Thank you. I'm glad that you said that, actually, because we talked about the first project, and I labeled it the idolized version, but I certainly did not need to imply that with what you all are doing, that even if the evaluation starts after the program itself has started, that there isn't a great deal to be learned, and it can't be a fabulous project in and of itself. I am curious, though, about for those who are starting the evaluation after the project has started, whether there are specific things that you have learned or guidelines that you can provide to help them to be more successful?
Maybe I'll go this time. I have tremendously, as Maria's highlighted here, tremendously appreciated the multidisciplinary aspects to it, and I think that can totally hold true in the planning phases for an evaluation or an evaluation of data that already is in existence. And I think part of that is just bringing different perspectives and really understanding kind of what data elements make most sense to any given stakeholder that you're functionally trying to engage with or present with. So I think that feels to me still tremendously critical and a universal theme. I think the other thing that made me think about, Bettina, I think, as you're asking the question, which is, I think data still matters here, right? Which is like, how do we kind of connect all these data points and data elements together? Because that would be reflective of the multidisciplinary, multiple different stakeholder perspectives to kind of really get to a common goal.
Yeah, and I think I'll just emphasize that even though we weren't able to start the evaluation until after the program launched, the fact that we were still thinking about it before it launched definitely helped make sure that some of the framework and some of the kind of foundations that would be important for the evaluation were still in place. And that even still, it wasn't too late for some of the specifics afterwards.
Thank you. I'll just ask one last question. I don't know if you have anything, any of you have anything to share about what else is important to bring about effective, successful researcher practitioner partnerships. feel like you guys covered quite a bit in your comments.
Also, there's like a little secret sauce that we maybe don't talk about all the time, which is just, I think, the collaborative nature of everyone. And I think I've generally found on this project, there's a real level playing field. I don't know if it's like the impact of Zoom, where everyone's just like takes up equal real estate space on the screens as we're talking, but I think in a lot of ways it allows everyone's voice, I hope, to be heard or feel like they're heard, and I think that really is just one hopes it's a really beautiful project at the end because of that level playing field.
I think it is worth calling out too that the folks and this was mentioned before, folks at Robert Johnson who've been supporting this project, I think they did a good job, I think, of connecting people who would be supportive of that type of collaboration, right, and bringing us together so that to do something that's fairly complicated, has a big team, and it's very interdisciplinary and could be unwieldy with other context, right, and bring folks together who'd be happy contributing to that big whole, and then giving some support to help give some infrastructure and to make that work. So I think calling them out also is important because they've been a big part of this team as well.
And then I want to add, I think actually building a little bit on what the previous panelists just shared on like the importance of collaborating with community or getting that buy-in. One thing that I think really ultimately shapes the way we designed or were thinking about evaluation was, at first, we thought we would be able to do the evaluation to have those baseline surveys at the time that people were enrolling in the subsidized annual pass. And from a kind of evaluation logistics standpoint, you know, it sounded like a great idea. We're like, yes, this will make it easier. We're capturing people right at the beginning. We won't have to then follow up with them later. But one really important feedback then that we got, again, from our partners that were more involved indirectly in interacting with customers and knowing what it looks like for them to be enrolled in the subsidized annual pass was, hey, actually, that's not going to be beneficial for you or for our clients. Sometimes they might be, at the time of enrolling, might be just after they finish answering a whole series of questions of, are they eligible for these cash benefit programs? So their mental capacity is going to be kind of limited, or also that, you know, the capacity on the staff is also going to be a lot. It's a lot to ask for them, for the customers and for the enrollers. And it was just a perspective we hadn't thought about. And I think in realizing that we didn't have to have those two intertwined as we originally thought, then also allowed us to, you know, take more time to think about what is a way that we could still make sure we're capturing the information that we want to in order to learn, but be able to make sure that it wasn't overly burdensome on our customers either.
Thank you for sharing that. So unless anybody else has anything to say, I think we're going to move on to our third project. So, you know, I think all the projects are timely and important. I think that something that distinguishes this particular one is how COVID, how of the moment it is in terms of people having to switch really quickly to provide emergency supports to people that they might not have needed to provide. And I know of a lot of organizations who have done that and who have not necessarily brought the research and evaluation along to be able to understand what the impact of those shifts in focus and resources really mean. So very excited to talk about this particular project that has been able to quickly gear up to do evaluation work. So Christina, could you introduce yourself and could you talk with us about King County's emergency rental assistance intervention? Thank you.
Absolutely. Thanks, Bettina. And first, just thank you, Carrie, for inviting me. And thank you, David, for being the kind of connection point between all of us here and bringing us together. It's nice to see you all. I'm the Housing and Homelessness Evaluation Manager for King County DCHS. So I lead a team of evaluators who focus on performance measurement and evaluation of homeless housing programs, affordable housing programs, and increasingly COVID response in the last year. We've been working with Leo and David in particular for several years now. We started with a randomized controlled trial of a youth and family prevention program. And so that relationship was really key to getting this project off the ground, an evaluation of our eviction prevention and rental assistance program, which began last year. And this is primarily a COVID response initiative. The eviction prevention piece is legal aid, and then the rental assistance piece provides, pays rent on behalf of eligible clients who are at risk of eviction because of COVID-19 impacts. There were 3 funding streams for this. I won't bore you with the details of that, but basically to say that with each COVID relief bill, more funding came. And so this is all focused on the first COVID relief bill, which was $37 million in 2020. There's $135 million coming through the county in 2021 and $177 more million that's not obligated yet, but likely to come through ARPA. So this is a huge amount of money, an unprecedented thing to start up this quickly. The whole country is feeling the urgency on this. This money is coming through every community. And in some ways, localities are kind of little labs of policy right now. We're all trying to do this new thing in different flavors in our communities. It's a huge effort to do it this fast, to meet all the reporting requirements, be equitable in how we distribute it, and get the money out the door. And we're all racing the clock with patchworks of local eviction moratoria. And so we have seen extensions of that, but we're always kind of trying to push to the next deadline. And I think in the broader context of this, I'll just add that the pandemic has pushed boundaries of what local governments can do. Aid is coming in huge amounts. Red tape is kind of being cut, and it's created a lot of opportunities for natural experiments, which I think is a huge factor in our ability to do this quickly. And so I'll talk a little bit more about that, but I think this is just, we saw kind of a huge opportunity to be able to test something novel at scale that could kind of inform what homelessness prevention and rental assistance look like into the future.
Thank you for sharing that, Christina. So I'm going to turn to David again. And David, I'm sure now the audience is getting a sense of how deep the partnership is between King County and Leo. So many good projects. So how did that relationship factor into your ability to step in quickly on this evaluation?
Yeah, I think it was really fundamental. So Christina and her team at King County DCHS and Leo had been working together on a prior project related to homelessness prevention for multiple years when COVID hit and all of this started happening. And so I think that did provide the context in which both sides could come to this and say, yeah, this is a partnership that's going to be useful on both sides. I think some of the important elements there of having that track record, some of it are tangible things that, right, it's hard to do some research activities quickly, right? It's hard to deal with the legal side of data sharing agreements. It's hard to understand quickly what administrative records, like what, given that in a short timeline, you're not going to be able to do a lot of new data collection, understanding what data already exists and not having to sort of sort that out really quickly on the fly, right? That, so I think that some of those like kind of hard, quote unquote, hard things of understanding what the context is and what's possible was there. But I think probably even more important than that is probably maybe the soft side of things, right? Of just having had that relationship and trust that goes both ways, right? Both from King County looking at us, Leo, and okay, these are our partner that we can trust our data with, and we can trust to think carefully about the effects of this program, to ask good questions, to know the King County context, and we can look at them and also know, yeah, they're a group of people with incredible expertise, right? They're going to be running this lottery. They're going to, and we know that they're going to run it in a way that's where they're going to be a reliable partner where we can understand how this thing's function so that we can on the fly really quickly, not, have to get involved in every little step along the way, which you can't when things are so intense. And so, and Christina's team is being pulled lots of different directions, just trying to get money out the door to people who really, really need it, right? That we can focus on some of the higher level things because we have that foundation of having trusted each other and worked together on prior projects. So I think that this is sort of a hard side of it, but in some ways, like the soft side of trust in knowing that, okay, this is a partner I work well with, is a big part of being able to respond to something that happened so rapidly as this program did.
Thank you, David. So I'm actually going to ask a question that anybody could respond to. So Erin Hagan had asked a question about the dynamics of forming these relationships. I make it sound like Shangri-La, but people have divergent priorities and perspectives. And so, how do you get to that place where everybody's aligned and things are moving forward as they should?
I mean, one thing that I would say is that one inevitable part of it is just sort of sticking with it and listening really well and working well together, because there's going to be differences at the beginning, and there's going to be misunderstanding at the beginning that you have to sort of understand, okay, how can I understand the perspective that someone else is coming with? So like on the previous project that we had with folks at DCHS on homelessness prevention, but one of the conversations that happened there, we started with, okay, let's measure outcomes only using whether this person shows up back using homelessness programs again as an outcome. And early on in the design process, there was a lot of pushback from folks who were providing these services to saying, okay, that's not a full picture of housing stability. When you get to the end of this and get the data, there's going to be other aspects of housing stability that are important. And then you fast forward a couple of years and that turns out to be true, right? And so I think it's really important that's early on having a context in which people are invited to share their thoughts on what's being planned in terms of evaluation. And then there's a listening ear to say, okay, that might make our life a little bit more difficult on the researcher side to figure out how to do this, but to make sure that we're listening so that that environment where people are able to have conversation, be able to say what they actually think about things, and hear and have research design and evaluation design respond to that so that it's actually measuring the right thing. I mean, to me, there's no substitute for just that process of conversation and communication. It doesn't mean we always get it right, but it means it gives us a better shot.
As long as you keep trying. Anybody else?
Okay, Bettina, I might suggest that Maria chime in here too. She's had some really great perspective on what it means to be a researcher that I'd love to have her communicate to the group.
Yeah, so earlier, I think, Bettina, you mentioned something about being the bridge between researchers and practitioners, and it reminded me of how that's the role that I'd been seeing myself, except I had phrased it as, capital, that I saw myself as like a lower R researcher working with these capital R researchers. And then realizing that that's not actually the way that I should be perceiving it, that everyone I've been working with is a researcher in their own way. And is bringing in their own expertise, and that we at least need to be doing a better job of being able to honor the different types of research expertise that everyone is bringing into each of these different projects.
Thank you. That's really helpful. It resonates. So, Christina, I wanted to go back to you to ask you, so given the urgency of this project, where everything was happening so quickly and the need was so obvious, why was it important to make sure to include an evaluation?
Thanks, Bettina. Yeah, I think one is, so we knew this was just the first of more to come. So at the time we were implementing, we knew more COVID relief would come through. This ended up being kind of phase 1 of 3. Each phase had sort of slightly different requirements, and it was very clear in the way that this sort of turned out that the country and Treasury at the national level, who was sort of administering the funds, we were all learning together and sort of adapting the requirements along the way. So I think there was just a huge opportunity here to try to learn as much as we could to inform those subsequent iterations of EPRAP in the COVID response setting, at least. And that's exactly what we did. So we ran our survey, David and team, in winter of last year. It was a pretty quick turnaround, maybe 6 weeks or so. And David was kind enough to share some of the data back with us. And we immediately started mining the customer feedback from some of the qualitative components and brainstorming tangible changes to EPRAP 2.0 based on that feedback. So that was a big piece of it. I think more broadly speaking, though, it was an opportunity to make the case for what prevention could look like post-pandemic, locally and nationally, I think. We get a lot of attention locally on homelessness response, but once you're experiencing homelessness, every other system has failed you, and it's much harder to solve your homelessness crisis than it would be to prevent it in the first place. But homelessness prevention is a tricky thing to study because it's hard to come up with that counterfactual. It's hard to measure what would have happened if we did not provide this. And so here we kind of had this nice natural experiment. We had inherent scarcity in the tenant piece of the program. So we had to have a lottery built in to the service delivery model. And that lottery was managed and designed by my team. So we didn't have to kind of deal with the tricky ethical piece of randomization because it was just inherently a scarcity issue with the resource. And so I think it's a nice opportunity in a real world setting to test a homelessness prevention program and also to look at what the non-housing outcomes were. And so a lot of our data collection involved other kind of ancillary benefits of the initiative.
Thank you. David, turning to you again, I wanted to just explore a little bit the difference in terms of researchers, evaluators often wanting to have time so that they can get to the right answers, and policymakers needing to address things as quickly as possible. And so that's a place where there's a divergence in priorities and perspectives. And could you tell us about how that factors into partnerships?
Yeah, definitely. And I think you're right? It's our different constituencies, right? My academic and policy making community that wants, answer whatever question you're going to answer, but make sure you absolutely have the right answer, right? And maybe a policy making community that's like, this is the question you must answer, and then do the best you can, right? Or maybe the caricatures of the two, right? And I think in this particular context, right, it is particularly stark because, like Christina said, the next version of the program is being built just a few months later, right? and so I think it was incumbent on all of us to make sure that we're coming together at the beginning of this and everybody is setting clear expectations of like, okay, here's how this can be informative and useful locally and not just sort of an extractive thing that's pulling out data and informing other people in other places. And here's also how it can be a useful thing, given that this is a national conversation, it's happening other places. Here's how what we're learning in King County can inform other places. And so that involved and so there's a commitment up front to doing both of those things well. And then that requires little specific commitments, right? It requires, like Christine said, a commitment from us as researchers to say, okay, we're going to add a few questions to this survey that we're funding with, outside research money or whatever, but we're going to add a few questions to this survey that are solely there as process questions to help inform the next version of this program, right? And that's part of us being bought into things that are local. And then there's parts from Christina's team that's bought into the fact that this program can help inform other people in other places as well, to say, yeah, that right now folks on her team are helping us work with the administrative data side of things, so that we can compare results of what's happening in Seattle to what's happening in some other cities, and the whole country can learn about how best to run these type of programs. And so I think there's sort of real practical commitments up front that make for time for everybody that people are going to put into this thing to make sure that we can do both those things and do them well instead of just doing one and leaving the other one shorthanded. It takes a lot of planning up front, I think, and commitment up front to make sure that we sort of listen to each other, we set those expectations, and then you have a partnership where everybody's excited about what we're going to get out of it.
Okay, thank you. So we're going to turn to audience questions, but before we do, I just wanted to give all of you an opportunity to share with us anything that you might have forgotten to say. I know I always have my talking points, and there's one or two things that I thought, oh, this is so important, but I didn't mention it. So if that is the case, please go ahead and share. All right then. Oh, that's great. Okay, so let's just jump into some questions then. So actually, going back to the first presentation, we were talking about how great it is to start everything from the beginning. And I wonder if there are any cons to that. So were there, any places where you wish that things hadn't started concurrently?
Sorry, Bettina, you're asking for the research and the
program started together, and I framed it as the ideal. But I wonder if there are, any negatives to that.
Yeah, I mean, there's trade-offs. I think earlier we spoke about some of the advantages of getting involved early on. Right, some of the advantages of starting later is that a program design is sort of more set and more clear what the thing is that's going to be, and it's easier to then at that point you can kind of design around it. But the disadvantage of being in that situation of where things are set is that then there might be research activities that are would be good for what the ideal of what we want to learn, but then would cause some cost and some friction for folks who are actually running the program. And then you have to make hard trade-offs between, okay, are we going to learn something that's a little bit less than what we wanted to learn, or are we going to have something that's going to take a little bit more time for people who are operating this thing, right? And then those real trade-offs between what are we going to learn and how hard is it going to be to do this thing, or can get a little bit starker once things are in process. I'd say that's in my experience, that's been the times we've run into disadvantages with starting a little bit later.
And if I can just add to that, I think David makes a lot of good points. I think the other challenge that we see kind of from that community perspective is I don't want to be part of a research project. And so I don't, it's great that you want to ask these questions, but what are you going to do with this information? And so that was something that we really took into account with our first phase with the community transportation navigators before we even moved into design, is how are we being respectful of the community's engagement in this project so they don't feel like we're doing research, to be frank, on them. We're doing research with them and that they'll see outcomes. And so the one thing that we're really carrying through this is before we approach new partners about engaging in our program, we're going back to our original partners and making sure that they have the right, not the right, but they also have the ability to continue participating in this, that they get to see those outcomes and be part of those outcomes. Because we definitely got some of that feedback early on. Well, I don't want to be a part of a research project, or I don't want my clients to just have research done on them. And then also always protecting their privacy. And so kind of balancing our need to gather information with the privacy of the client. So I wanted to throw that in there as well, as not a negative by any means, but a challenge that we face in working with the community.
Thank you, Sarah. I'm curious from everybody else whether there are challenges that you'd like to speak to as well, because it's always helpful to our audience to hear about what others have struggled with and any lessons that they might have learned.
I'll make a comment that I think we kind of alluded to earlier, which is about the speed of findings or how fast you get to our results. And I'll say I heard that tension, I think, in our collaboration from a policy making standpoint, and the timing of that information kind of falling in at the right time when decisions are being made. We also hear it a lot on the healthcare delivery side of like, there are some things that research would just slow you down because you're like, you need to make a decision tomorrow, kind of thing, or yesterday sometimes we're told. And so I think it is kind of a tension here is to choose the right kind of projects, collaborators, tempo that kind of makes sense for perhaps some longer term strategic vision or some way to inform those processes. And at the same time, I think you can, I'll say, you can actually incorporate researchers to help think about kind of the yesterday questions or the tomorrow questions. It doesn't have to necessarily lead to, say, publication or some kind of product there, but I think I think there's some value in thinking about how to kind of take the information that you have and make the best kind of evaluation or get to the closest answer you can to make that more immediate decision too.
Thank you. Oh, Carrie, are you raising your hand?
Yeah, I am. I thought I would just add in a little perspective on this point in the conversation here, which is, I think as decision makers, and this really points to a lot of what Christina was talking about, we're really used to dealing with imperfect information. And so, the fact that we can work with researchers and the results that we're getting may not kind of reach the researcher standards of what the quote unquote right answer is. But for us, it's like better imperfect information than what we had before. And so, I'm always interested in trying to get to the best imperfect information that we can and really try to understand what those imperfections are so that we're kind of making decisions with our eyes wide open. I'd also say that, we're really trying to be clear about the decisions that we have in front of us and making sure that we're tying the research work towards those decisions, and that we never view one study as like the definitive answer, right? Even if we go through a whole process of, a peer-reviewed publication and these are the results and we feel really confident in those, there's always more for us to learn underneath that. And so we really have to view any project as an evidence building project that we're going to add to over time. And that's why I think, these longer term collaborations are so important, because we basically have an endless pipeline of research questions that we want to answer, and a great team of people that we can work with over time to answer those.
And every program, every project can benefit from improvement, right? So while I was at the Harlem Children's Zone, if 95% of the pre-K students were deemed school ready at the end of the year, I was always focused on that 5% and what to do to get them to where they need to be. And everybody would say, hey, give us credit for the 95%. I'd say, yes, I do. But how about the rest? How can we do even better? And it's not just about one and done, but about continuous improvement. And so I think that these partnerships are also tremendously helpful for that. So one thing that I'm always curious about is, already this seems like there's a cast of thousands for each of these projects, but I know that there's always more people who are involved in preparing the organization, preparing the container organizations so that there can be success. So I wonder if anybody would want to speak to the work that was done, the process of getting buy-in, getting engagement, and making sure that the work moves beyond your team cluster.
I could try to add something to that. I'm going to toot my team's horn a little bit, and my broader team as well. And we're part of a performance measurement and evaluation unit with KCES. And so that unit has grown threefold in as many years, and has been investing heavily in data infrastructure and data integration across multiple administrative data systems. So I think it's been really helpful in sort of setting up the internal seeds that sort of power a lot of these external partnerships. And also we have staff who have evaluation and research background in-house who can kind of embed closely with programs, make relationships with them, make these connections between external parties and programs, and kind of speak both languages and sort of help to kind of alleviate the fears that program staff might have about, some of the things David talked about of like, adding data collection or tweaking program design to sort of facilitate evaluation. And I think that was very much the case with UFIPI, our prevention program, for the acronym, and our eviction prevention and rental assistance program. And it also means that we are able to sort of see the opportunities. So several times throughout the pandemic, my team were sort of been, the Forrest Gumps watching history go on around us, watching the program staff just move mountains to just make amazing things happen. And we're able to sort of see there's this natural experiment. We need to find someone. We know David. Come here, David, help us with this thing. And so being able to sort of like have the seat to see those opportunities. And then also to say, hey, add this data element, because if we flag this thing, then we can now study it. And so I think kind of building that internal data capacity is kind of foundational to being able to do some of these bigger projects and invite in our external partners. And I know we've had great relationship with David and Leo. And I'm also trying to cultivate more relationships. It's sort of been inspiring. We participated in a MIT collaborative that sort of brought us together in the first place several years ago. But now we're sort of reaching out to University of Washington partners. They have a homelessness institute, trying to kind of have multiple folks that we know of already, so that when we see these opportunities, we can jump right on them.
I just really want to underline a couple of things that Christina said from the researcher side. Just King County generally, and specifically King County Metro and DCHS, have spend a lot of time building capacity in terms of the people and also the data systems and such, but especially the people who are involved in evaluation, that this stuff doesn't happen. Whenever, right, the world that we live in tends to say, a Notre Dame study says X and it puts my name and two other people's name on it. And reality of a project that like 100 different people at least have contributed to, right? And it's like, whenever I present these things, the first slide in the presentation is always just like a thank you with just a gigantic list of names, because any of these things require so many people for it to actually function that I think it speaks a ton to the capacity of both people on this call and just like dozens of people who are not on this Zoom thing right now, who without whom like these things just absolutely don't happen. And so I think, I love your question, Bettina, because it's that internal capacity, both for actually producing the evidence and then receiving it and doing something useful with it, is just so incredibly important to make sure that we're not just creating evidence for evidence sake, but actually creating it in a way that's going to be useful.
Thank you. So I'll just turn everybody to a comment that Carrie made in the chat, which was that Christina was referring to JPAL at MIT, which matched King County and Leo. And there's a link in case anybody wants to learn anything about that. So Milagros de Haas, maybe you'll let me know if I mispronounced your name, but I saw that you had a good question that I'm happy to share with the audience, or if you want to go ahead and share and actually ask Maria, Krista, and David. So it's up to you. You want me to ask or?
Sure, I can jump in and give, I know it's a very specific question, but we have two experience with two different projects. One in which the evaluation was embedded at the very beginning. So when people were applying for, in this case, was Fair Fares in New York City, we embedded a link there to a survey asking about how they use transit, etc. And they could answer that survey within 30 days of their application. And Maria just mentioned, like, when someone is going through an application that requires so much like thought and revising documents, etc., is that the best time to ask them even more questions? I guess our thinking was like, okay, they may not come back. And the other question is like, okay, I'm working on another project, not related to transit, but the program already passed, and we're going to be contacting people who participated in the program 6 to a year, to 6 months to 12 months after they participated, and we are concerned of whether they're going to remember or not. So just wanted to hear your thoughts on how you may have deal with these two different things of when you're asking the questions.
Yeah, and I can start answering this, and then again, my colleagues can jump in. But one thing that for the first question of, I guess for the subsidized annual pass, we're actually trying to survey people before they enroll. So anyone who is already enrolled, we're not following up with them for that reason, that then we're not able to actually capture a good baseline survey, but we're trying to capture people who would end up enrolling, and that through the process of doing the baseline survey, then enroll. It separates out that process a little bit. The other question of how to increase engagement, one of the things that our partners, PRR, have been really great at is so there's been a couple of things. One is making sure that's available in more than just English, that is translated in multiple languages. And they're also being very, very, very intentional about pre-testing the survey materials with a couple of people that would be filling out the survey to get a sense of, hey, how does this sound? Does this make sense? Is this any of this scary or turns you off? And this actually brings me to something else that I wanted to point out. As Sarah was talking about privacy earlier, that was something that came up during the pre-testing, which was originally we were like, oh, we're going to connect your information to administrative data. And then the question was like, well, what kind of an administrative data? And it did force us to pause and reflect, and then we end up being more transparent about the data that we were collecting, as well as then also really examining which data are we collecting and which is actually necessary in order for us to be able to make that impact evaluation that we're trying to learn, and which was more of good to know, but really if participants didn't feel comfortable in getting that information, then we really shouldn't be asking if it's not actually moving forward our learning agenda. But yeah, so ultimately, I think being able to have that kind of community testing, having that community review and weighing in on what that looks like, I think is gonna help our response rates. At least that's the hope. We're about to start, so it's hard to say for sure.
Maybe two little things to add in addition to those, which I very much agree with. One is just on the practical side for surveying. Again, Maria highlighted our partner PRR is doing a lot of good work on the survey side. And one thing they nudged us in the direction of that I think is a good idea for this one is we're trying to follow up people a year later. And one thing they nudged us toward is, okay, let's have some contacts with folks in between then, not just when you start off and a year later, but also have lots of contacts in between to try to keep some connection. I think that's one thing that we're hopeful will increase response rates. Another is recognizing, I was talking before about how there's dozens of people in terms of the staff that are involved in these projects. There's also the case that every respondent to a survey, is a fundamental contributor to this project, and their time is valuable. And so to the extent that it's possible with budgets and getting support from external grants and stuff, compensating them for their time. And so like the people who are going to be taking the surveys, it's, they're providing us and their community with lots of very useful information, and they're going to get compensated for that. And so I think that's, whenever that's possible, is both from a respect point of view and from getting high survey response rate point of view is a great thing to do. The last thing I'd say, and Maria also just underlining one thing that Maria said and maybe expanding a little bit, is sometimes when use of administrative records can help a lot in a situation, particularly like the example we gave with the emergency rental assistance. We have to move really, really fast, and you may not be able to put in all of the foundations that you would like to for a really high response rate survey. That being able to pair that also with some data that's already being collected on folks and using that in a careful and responsible way and de-identifying and so on might allow you to learn something more about the whole group of people. Even if you can't learn everything, you can learn some things about the whole group and then learn some more detail about a smaller group of people. Those are some of the things that we've done to try to deal with the difficulty of just people are busy and they don't always answer the survey.
Thank you. I appreciate all of your comments. I am going to quickly turn things over to Carrie because we do want to be respectful of your time. We're almost at time. So thank you all very much. Carrie?
Thank you so much, Bettina. A big part of building great researcher practitioner partnerships is being grateful and thanking folks and congratulating everybody on work super well done. So thank you to all of our panelists. I also want to call out Matt Friedman, who's in the audience, and Trong Hong, who's from one of our partners from the state, who've been really instrumental in this work. So thank you all. One of the things that's been so great about our work together across researchers and practitioners is that each one of us is really putting the community first. And, it's really recognizing that the service comes first, and then let's organize our service in such a way that we can get the best information about the impact that's coming out of it. And so that's part of what has led to such great partnerships. We'll be in touch with all of you soon about our next event, part 2 of Great Researcher Provider Partnerships, coming up in January, date TBD. But you'll hear about another 3 or 4 projects at King County where we've got other research partners we're going to bring in. David will certainly be part of that conversation. Matt will be part of that conversation. So really looking forward to having you all there. And in the meantime, enjoy the winter holidays. And thanks everybody for being here for this conversation.